The most common tests to detect COVID-19 are the PCR test or the blood test, which is called a serology test. PCR tests are collected with a specimen using a special swab that is inserted into part of the nose. Most of the time, the results will be back in about 24 hours. The COVID PCR test tells you whether the virus is in the body. It does not tell you whether the virus is live. For people that are symptomatic and they have a positive test, it means you have disease. For a person who's asymptomatic and is exposed to someone, it means you're at least carrying the virus. Overall, the tests are very accurate, but definitely not 100%. There are occasional false negatives. The false negative test means that the virus is there, but the test didn't find it. That is actually uncommon, but does occasionally occur. Antibody tests for COVID-19 are available through Sutter Health Network as well as outside laboratories. They measure whether your body has had the virus and whether it's developed a response to fight it, but does not in any way suggest that you might not get it again. We do not have information on that, and we should not use that as any form of guidance. People who are asymptomatic or people with mild disease may not develop antibodies. The antibodies also may decrease with time, and the value is questionable. If you think you may have had COVID and you would be interested in donating plasma to assist a patient who is ill, we call that convalescent plasma, that would be an appropriate test to obtain to see whether you've actually had the disease and might be a candidate to make donations. We have multiple ways in the Sutter Health system for you to get tested for COVID. If you are symptomatic, you can set up a video visit. We have set up urgent care centers and respiratory clinics in different locations for collecting specimens. For those patients who are critically ill and really need to be seen, we obviously have emergency services that are available at all our hospitals. If you're sick and they suspect COVID, it's a useful test.